Hello.
Or at the Public Speaking Cabaret.
Yep. Hello.
Hi.
I'm Andrew Campo. I am presenting for the 11:30 public address class, and this is my persuasion speech. So, death is something in our society in the United States that kind of has two natures to it. Is we don't really like confronting this idea that this is something we all experience, and yet it's also something we hear about and are forced to think about through media, life insurance, all these different things of kind of this inevitability of it. And one of the things that is, I think, very troubling to me is the idea of suicide, and especially suicide in the United States, due to this kind of conception we all have of death. Is, we don't want to think about it, yet we're constantly bombarded and forced to think about it, but it seems like that's not the case with suicide, is we just don't think about it, and I think that's wrong. Today, I'm arguing that suicide is a public health crisis and something that we need to be cognizant of and talk about more than anything, and bring it out of this kind of stigmatization that many people put on it. So today, I'll be going over the statistics of suicide, who is most affected by suicide, and how these people are being affected with suicide, and then finally wrapping it up to an argument to why you should think suicide is a public health crisis. So suicide in the United States is the 10th leading cause of death, and there were over 500,000 cases of people in hospitals being treated for injuries of self-harm, and then there were about 47,000 cases of suicide in 2017. Both those metrics are from 2017. And more than half these people who committed suicide had no known underlying mental health condition. So what this boils down to is that there are about 129 lives lost per day due to suicide in the United States. 129 families losing a brother, a sister, a father, a mother, a relative, a friend, and yet we still aren't talking about it and aren't confronting it and treating it like other diseases, other problems that we see in the United States, other causes of death. So the other thing is that there are twice as many suicides as homicides in the United States, which is a shocking thing to me, due to the fact that, I would think people would be more likely to kill each other than themselves. I know it sounds morbid, but I think it makes more sense to me that, when people are angry, they might retaliate, but that people feel something so wrong inside that they would take their own life. So now that I've talked to you about the statistics of suicide, I'm going to talk a bit about who is really affected by suicide in the United States. All the data that I just talked about, and which I'm going to talk about now, is from the Center for Disease Control Fatality Injury Report, and then with the American Foundation of Suicide Prevention, which is another source that partnered with the CDC to present all of this data publicly. So now I'll be talking about who is most effective. Now, suicide is the second leading cause of death for people from ages 10 to 34. Now that is about plus or minus 10 years of my life. I'm now 22, and you're thinking 10 to 34. These people that have the majority of their life ahead of them, it's the second leading cause of death. Now, while this is absolutely shocking, is the high suicide rate actually belongs to those between the age of 45 and 54, and the second highest rate of suicide belongs to those 85 years old and older. Now, getting to another segment of it is that white males consisted of 70% of the suicide rate in 2017, but white people aren't alone in having a high suicide rate. Is the only one that is slightly less than white people's suicide rate is American Indians, which is just unfortunate for so many different reasons. And now that I've talked about kind of the demographics we're looking at, you know, middle-aged white males being really affected, and I think that's something. These are the people that consist of most of our country, which is, you know, it makes me wonder, why is this happening? What can we do to help? Now, I think there are many reasons that we can't really quantify or even qualify for why someone would take their own life, but we have found some things in why people are being infected and why they might have higher rates of suicide or low rates of suicide. And these findings are from Steele Smith et al., a 2019 research article, and then Madani et al., a 2017 article. So there are higher rates of suicide associated with ruralness, is rural communities, and this idea of social isolation, deprivation, fragmentation, this kind of existing outside of a social reality, social presence. And I think that's something that we're all experiencing right now during quarantine for the coronavirus, is social isolation. And I think many of us can feel how it can affect our mental health, just kind of this isolation, and how much we rely on other people to give us that joy of life and that thing. And then other things that affect high rates of suicide are physical health conditions. Like many diseases that take the lives of many of our loved ones, is, you know, the physical health affects a lot. Also, lower rates of health insurance, higher per capita gun shops, and then finally getting into kind of family and personal dynamics. If you have family history of suicide, aspects or misuse of drugs and alcohol, whether acute or chronic, experience with self-harm, and then, you know, stressful life events. These all heavily affect, you know, the higher rates of suicide. Now, there are things that lower the rates of suicide, which is, and we know what these are. So this is not all of them, but we know some of them, which is the hope in this bleak topic. So is the idea of social capital, the presence of other people, a strong community. If psychiatrists and psychologists is per capita, higher rates of them will correlate with lower rates of suicide. Connectedness with others, people in your life, friends, family, in a really strong presence of that. And then, you know, another big aspect that isn't commonly talked about is culture, is living in a culture that does not have taboo or stigma related to suicide. So with all the facts I just presented you, I'd like to make the argument that this is a public health crisis. And everything that I just went over, I think is self-explanatory on why that is. Having 129 people take their own lives per day is something shocking to me, and it's something that I think we need to be treating like other diseases, cancer, stuff like that. We have this conception that, you know, heart disease and all these other diseases are, one, they can be helped, they can be treated, and while it might not fully solve the problem, there's treatment, they are treatable illnesses. And the other thing is they're preventable. And I think that this isn't always expressed in the way of suicide. I think we've lost so many lives, and it's increasing, which is the shocking thing. And I think that's one of the most compelling arguments for why this is a public health crisis, is this is an increasing thing, that if we don't pay attention to now, since we haven't paid attention to it before, if we don't start doing it now, I think there will be serious consequences of what will happen. is I think we've already reached the serious consequences. I think one life lost due to suicide is just terrible. And having almost 50,000 per year and increasing is shocking. It's very shocking. Now, today, I talked to you about why suicide is a public health crisis. I gave you the statistics of what has happened. I went over what people are most affected by this, and then I went over reasons for increased suicide, lower rates of suicide, and then finally brought it all together to express my thought that this is something that we need to pay attention to and treat like other illnesses.
Thank you.
Yep.